Hello, class 8. Okay, by looking at the picture there for you all present there, think so the topic you have understood. Okay, so today's topic is first aid. So you should understand what a first aid. I guess you all know what a first aid. You have been studying, I guess, from class 6. No, class 5 we have been studying. You have coming across this term. So it'll be easy for you all to describe this. So first aid, always remember, it is an immediate aid or help or assistant, okay, that is given to a sick person or an injured person before any professional medical attention is provided or before he or she is taken to the hospital. For example, during accident, heart attack, snake bites, all these purposes we give them first aid. Here, and on this topic, you should remember that a first aid box. This is to show you the items that are present in the first aid box. We need a first aid box. Okay. So, what are the things required there? So, always remember that a cotton, sterilized cotton, clean cotton should be there. Bandages, small glasses, droppers, scissors, blade and pins, forceps, small torch, matchbox, candles, and threads. They are required. These are the items that should be present in a first aid box with which you can provide help, immediate help. Okay, if a person is in need of it. Here you can see there different incidents where we can give them first aid. So here, bleeding, burns, fractures, sprains, eye injury, shocks, choking. So these are the different situation when people need first aid. You can help themselves before they are taken to the hospitals. So some of the cases we need first aid. Okay, so let's go through bleeding first. Suppose if you see your friend bleeding or he has a cut or a wound, you should remember the skin breaks and bleeds. No, so when a person is suffering from serious cuts, what are you going to do? So first, foremost important thing is raise the affected part to minimize the flow of blood. Then after that, you can wash the cut surface with a clean water, okay, and dry it with a piece of clean cloth. Then after that, you can apply mild antiseptic. Okay, so if the bleeding is very profuse bleeding, okay, bandage the cut, okay, and take the person to the hospital immediately. Then comes, suppose you see anyone, your friend, bitten by animals, what are you going to do? In cases of animal bites, a wound caused by animal bite should be thoroughly washed with soap under running water. Then after that, the victim should be taken to the physician. If possible, the animal that has bitten should be caught so that it can be examined by the veterinarians, okay, to determine whether it has rabies or not. So mainly it is dogs, cats, stray dogs, cats, no, wild animals such as bats, squirrels, and foxes, they can transmit rabies. So you should be cautious about it. Okay, and next one is snake bites. Snake bites most often bite on the leg, foot, hands, or arms. In cases of snake bites, it occurs near in the field areas or where uh, trees are found around in the forest areas mainly. No, so in cases of snake bite, wash the bitten area, okay, with strong potassium permanganate solution, and tie a tight bandage just above the wound to prevent the spreading of the venom into the bloodstream. Then, after that, you need to give him a hot drink to the victim and keep him warm. Take the patient to the doctor immediately. Then, stings. Okay, sting. You know what are stings? When insect like bees and wasps, what do? They sting. No, the sting are rarely cases. Okay, but they are very very painful. You know that it gets swollen up. No, the pain may be relieved by pouring cold water or applying ice on the affected area. So, if it is very very painful, you can do this. Sometimes covering the bite with a paste of baking soda and water is also helpful. Burns now. In cases of minor burns due to fire and all, you can wash the affected area immediately with lots of cold water for a few minutes to relieve the pain. When this pain subsides, cover the burnt part with a dry bandage, sterile bandage. Lay the burn victim on the bed and give him mild salted fluid to drink every 15 minutes for an hour. Suppose now next one is the fracture. Suppose you are running, you're playing with your friends there in the compound, school compound, and he falls down. Okay, what are you going to do? He cannot walk. Fractures, it is a breaking of the bone due to fall or an accident. The bones of an overweight person gets easily cracked. When these bones shift from the joint, it is known as dislocation. Remember that dislocation of bones. Okay, so in cases of fractures of bones, you make the patient lie down on the bed. Then after that, loosen the clothes without moving the injured part. Tie a sling, okay, small sling with a wooden scale under the fractured part. You need to give a support to that fractured part and take the patient to the doctor immediately. In cases of poisoning, what are you going to do? In case of a person has consumed poisonous substances, give the person a milk or water and try to induce vomiting. Okay, you need to provide them milk or water, salt water mainly, plenty of salt water, or you can just put your finger down to the victim's throat that he can vomit out all the poisonous substances. If unconsciousness, what are you going to do? Unconsciousness occurs as a result of sudden drop of blood supply to the brain. When a person has fainted, lay him down comfortably. Okay, then what do? You have to loosen his or her clothing and make sure that he or she is receiving fresh air, adequate amount of fresh air around the person. Then sprinkle some water on his face. Okay, while consciousness returns, encourage the person to rest for a while before moving on. Then comes if you get something in your eyes, foreign bodies enter your eyes, what will you do? Will you rub it? No. First of all, you pull the lower lid down and inspect the eye carefully to locate the foreign body. It can be removed by lightly touching a small piece of moistened cotton to it. Otherwise, if the cotton is wrapped around a small stick or applicator, it will be easier to handle it or take it out. Then rinse your eye with eye wash or mainly boric acid. Okay. Then, if these methods are not successful in removing the foreign bodies, you need to take him to the hospital and you need to meet the physician. So these are the immediate help. Okay, so you can give it to a person who is really in need of. So you should know first aid, the idea of first aid, you should have it. So go through it. Okay,